Hi, and welcome to the Ask Dr. Angela show with everyone's favorite OBGYN, Dr. Angela Jones. Have you ever been just too embarrassed or shy to ask your own doctor a question about your, private stuff? Well, you have come to the right place to get straight answers. Feel free to ask Dr. Angela anything women's health related. OBGYN, she keeps it real. Pregnancy, she knows what you're expecting. Whole body health, just ask. Dr. Angela has you covered, girl. And now here is Dr. Angela.
What's up, people? This is Dr. Angela, everyone's self-proclaimed favorite OBGYN, and I would like to personally welcome you to episode 40 of the Ask Dr. Angela podcast. How many of you out there have kids? Well, I think that I've shared with you that my wife and I have a 6-year-old daughter, and she constantly keeps us on our toes. I mean, quite frankly, that's part of the reason that we work out so much, so that we can make sure that we're in good enough shape to keep up with her. You know, we've got a double team little Miss Francesca. Anyway, kids definitely run the roost. And Francesca recently told my wife that she wanted to go to the Bahamas. And so Tasha said to me, Ange, have you talked to Francesca? Did she tell you where she wanted to go for spring break? And I'm like, well, not directly, but every time I see her of late, or she comes into a room where I am, she starts singing that Bahama commercial. She's like, it's just better, mommy, in the Bahamas. I'm like, are you serious? Talk about the power of suggestion. Anyway, I guess it looks like we're going to be going to the Bahamas for spring break, folks. But anyway, very common topic that I deal with on a daily basis in my office is postmenopausal bleeding. Postmenopausal bleeding, what the? I can't say the F word on the air. It's kind of offensive to some people, but frankly, the F word is like my favorite bomb to drop. But anyway, postmenopausal bleeding, WTF, right? So you're minding your own business. You're like so happy that you're not getting your periods anymore. And then all of a sudden, damn, out of nowhere, you got this bleeding, this spotting, and it totally freaks you out. Well, whoa, Sally, don't freak out just yet. Call your doctor, your friendly OBGYN, and make a visit to be seen. Now, in order to be considered in menopause, remember, it has to have been an entire year without a period. If you've gone an entire year without a period, then by golly, you are considered to be in menopause. So any spotting after being declared in menopause, you have got to tell your doctor about it. Don't freak out. There are many, many, many different causes of postmenopausal bleeding. Probably the most common one is atrophy. And all atrophy is, it's like a phrase that we use to describe lack of estrogen in the vagina, which results in your vagina being dry, less elastic, having less folds. Atrophy is responsible for the tissue thinning, being more easily traumatized. It's very, very, very common. Again, the most common cause of postmenopausal bleeding. Other very common causes of postmenopausal bleeding are going to be structural things like endometrial polyps, or perhaps you have a fibroid that's submucosal and is kind of impinging into the lining of the endometrium. Certainly, trauma is a cause. And the other thing that's very common is sometimes women are not even really readily able to identify where the bleeding's coming from. I mean, it could be coming from your rectum, it could be coming from your bladder. But the fact of the matter is, if you are having any bleeding in your postmenopausal, please, please, please don't delay. Go in and see your doctor. I know you're scared. You're like, oh my gosh, something is wrong. That's not necessarily the case. However, the big reason that you need to be evaluated is because in my practice, postmenopausal bleeding is cancer until it's proven otherwise. Now, don't freak out and think, oh my gosh, Dr. Angela said if I'm having postmenopausal bleeding that I have cancer. That's not what I'm saying. However, what I am saying is that cancer is the biggest thing that I have to exclude. So typically your workup is going to include something like an ultrasound to look at the lining of the uterus. And in someone that's postmenopausal, we typically like to see that lining less than 5 millimeters. The other thing that may or may not be a part of your workup is going to be some sort of endometrial sampling. And that can take the form of an endometrial biopsy, which we perform pretty regularly in our office, or a hysteroscopy DNC. I do a lot of endometrial biopsies because they're easy. patients tolerate them very well. And typically, I only resort to hysteroscopy under certain circumstances. And that's going to be, number one, if I was unable to get an adequate sample after having attempted an endometrial biopsy. Number two, if the patient just flat out refuses a biopsy and just wants to go straight to hysteroscopy, DNC, which stands for dilation and curettage. Or number three, if we've managed this conservatively, because the ultrasound may have shown a very thin lining, and we get a second occurrence of postmenopausal bleeding. Just word to the wise, while it's highly unlikely that if your lining is normal, i.e. less than 5 millimeters, and I'm speaking specifically for women that are postmenopausal, if your lining is less than 5 millimeters, it's highly unlikely that we're dealing with the cancer. However, I still do recommend biopsy for women that have normal endometrial stripes, i.e. linings that are less than 5 millimeters, because although it's unlikely, I have actually diagnosed uterine cancers in people that supposedly had normal linings. So I'm hoping that this podcast has been enlightening and certainly provides some insight into postmenopausal bleeding and what the workup might entail and what you should do if you happen to experience this. Thank you so much for tuning in to episode 40 of the Ask Dr. Angela podcast. If you have a question or a topic that you would like addressed, please go to my website. That's www.askdrangela.com. Click on the microphone on the right-hand side of the page and do what you do. If we do happen to feature your question or your topic of inquiry on the podcast, we will send you one of our bomb-ass t-shirts. Someone from my team will reach out to you, gather your information, and we will send it to you. In closing, I'd like to leave you with this quote from Vince Lombardi. Perfection isn't attainable, but if we chase perfection, we can catch excellence. Thank you so much for tuning in to the Ask Dr. Angela podcast. Until next time, look better, feel better, be better. I'm looking forward to reconnecting on episode 41.
Thank you for listening to the Ask Dr. Angela podcast. For more information on women's health and the show notes for this episode, please visit Dr. Angela at www.askdrangela.com. While you're there, don't forget to leave your own message for Dr. Angela. See you soon! All of the information provided and discussed in this podcast is for educational and informational purposes only and should not take the place of consulting a physician. This podcast is not intended to diagnose, treat, or cure any diseases or illnesses and does not and should not replace treatment for a medical professional. Listening to and participating in this podcast does not create a doctor-patient relationship between you and Dr. Angela Jones. If you need medical advice or assistance, you should consult a physician. Listening to and participating in this podcast is subject to the terms and conditions posted at drangela.com/terms.